So stem cell therapy typically takes about 4 to 6 weeks for you to notice any type of reaction. You get one shot, the cells go in there, and we use umbilical cells where we're going to put around 4 to 5 million cells in a joint, and they'll replicate in there, and they will build and regenerate that joint, and you're not going to feel anything for 4 to 6 weeks. And then typically around that 4 to 6 week mark is when you start to notice a difference. You wake up and feel like, wow, I can get around. My knee doesn't click anymore. My pain's gone. And that's when people typically feel the beginning effects of stem cells. Now, there are cases where people will literally feel something overnight, and they'll feel a difference and they feel like a new person right away. But we're cautiously optimistic that something like that would happen. But the reality is typically 4 to 6 weeks is our typical time that stem cells take to notice a difference. But with stem cells, then it's done. You don't need to get another shot. You don't have to keep going back like with a cortisone shot or medication, because cortisone, medication, they cover up problems where stem cells go in and regenerate and repair the joint, so you don't have to keep doing it. One of the best things about them is that you don't have to match these stem cells to people. It's not like a blood transfusion or an organ donor where you have to have a specific blood type or things like that. There have been no cases of allergic reactions. There's no cases of rejection of stem cells. And really the worst thing that can happen with stem cells is that you don't get any better. You know, our success rate is very high, over 85%, but with stem cells, really the worst thing that could happen is that you feel no change. There are some people that feel a little bit of a flu-like symptom, and that's typically kind of that queasy, scared of needles kind of thing. But as most of our patients will tell you, stem cell injections are much less painful than a cortisone injection and typically are very well received.